5.6 and 5.7. Here we go. Approve, 5.6 is approve agreement for professional services to provide alternate public health officer services with Anju Goel, MD, MPH for a term of 12 months for an amount not to exceed $95,000 for the term of the agreement, and authorize the Health Services Director to sign. Health Services Director Arton and Lisa Farraco. Do it right? Farraco. See, I knew it. Go ahead, Supervisor.
Yeah, the reason I pulled it, this and 5.7 is because I'm just wondering why we have to have two alternates, because we do have our new PHO starting soon in a few weeks, and I don't believe we've had two alternates in the past. So just before we approve these two contracts, I just wanted to get a better understanding.
Yeah, thank you, Supervisor Pyska. The reason why is redundancy.
The light's on.
Yeah, I tapped it.
There you go. There you go.
Always have a problem with this thing. Okay, so part of the reason, redundancy, expertise. Each backup health officer brings a different level of expertise, continuation of operations planning, recruitment pipeline. Also, if our new health officer were to go out on a long vacation or medical leave, if we just had one, they may not be available that entire duration, so it'll give us another option to help for coverage. So it's, this would be a good thing for us long-term planning.
I'm kind of feeling like Jessica is, that with our new health officer coming in, I just didn't see and I thank you for bringing that up, because I meant to.
Is the background concern cost?
Well, cost is always an issue. And I feel like we will have that redundancy when we have our PHO and our alternate. So I can't really justify having, a PHO on paid salary and then two contracts for backup.
Mm-hmm. I concur on that.
Okay.
All right. Go ahead, Vice Chair.
Yeah, thank you, Supervisors. I had the similar questions yesterday, but I did talk to Director Arton, and no longer have the concerns, just because of the implications that could happen if we don't have somebody readily available to go. For example, if the PHO, the permanent PHO, were to be, say, out sick or unavailable, and then also the backup was unavailable, then we're in a situation where we can't sign death certificates or birth certificates or things like that. I also had concerned about the cost as well, but in discussion, it sounded like we wouldn't most likely be anywhere near even the $95,000 with both of them combined over the course of the year. So that's why I was comfortable with it after I had discussion with Mr. Hart.
That's correct. It's just up to $95,000. Doesn't mean we're going to use the $95,000. It's one contract, I believe, is for 4 hours minimum a month, and the other one is for 6 hours minimum a month. So it would be at their hourly rates. So.
Supervisor Sabatier and then Supervisor Owen.
Just to clarify that, because I was just doing the quick math, and this wasn't necessarily an issue for me, other than if we use them, we have to use them. Mm-hmm. But if they're asking for 4 hours at $155 an hour, that's less than $7,500 for the entire year, if that's the only thing that we ask from them, and we're not asking them to do the job. If we're asking them to do the job, we need them. Yeah. So I'm not worried about if the fact is we need them. $7,500 is not something I'm too worried about at this moment in time.
Supervisor Owen.
Yeah, and you know what? That makes me feel better, because I misread it. I thought it was $95,000 apiece.
No.
So that's why I was concerned about it, was strictly because of the money. So,
I'm glad I asked the question then.
Yes.
I kind of figured that might be the case.
Yes, that was it. So I
up
just
to
kind of I did read that portion, but I still thought we were contracting to $95,000.
Yeah. I apologize. It's just my emergency planner in me. I always like to have redundancy and lots of different expertise at the table. Again, long-term wildfire, natural disaster. It's good to have these health officers, another pandemic.
Yes.
Each one brings a different level of knowledge and different expertise, a skill set to the table. And again, God forbid if something were to happen to our primary health officer, it would be nice to have 2 on rotation filling in because sometimes you like to take a vacation.
No, I feel
sometimes you're
better
out sick,
after
so.
finding out it was the hourly and 4 hours and 6 hours, so that's fine.
And I think the more relationships we have with people with this expertise, the health officer, again, it helps build that recruitment pipeline if there's ever an opening again in the future. And God forbid that doesn't happen anytime soon.
All right. If there's anyone from the public that has a question, concern? All right, I'll bring it back to the board for action.
Mr. Chair, I'm assuming that, well, we're just on 5.6.
5.6, yeah.
yes, but I will move to approve the agreement for professional services to provide alternate public health officer services with Anju Goel, MD, MPH, for a term of 12 months for an amount not to exceed $95,000 for the term of the agreement, and authorize the Health Services Director to sign.
I second that.
I have a motion and a second. All in favor?
Aye.
Any opposed?
No.
Motion passes 4-1. Next, we'll cover 5.7 since we're there. Approve agreement for professional services to provide alternate public health officer services with Amy B. Garlin, MD, LFD, LLC, for a term of 12 months for an amount not to exceed $95,000 for the term of the agreement, and authorize the Health Services Director to sign. Supervisor Pyska, did you want to go into this again? Same thing?
Just the same concerns.
Okay. And you have anything to add? Or no? All right. All right. With that, I'll open it up to the public. If there's anyone that would like to comment on this, bring it back to board for action.
Mr. Chair, I'll move to approve the agreement for professional services to provide alternate public health officer services with Amy B. Garlin, MD, LFD, LLC, for a term of 12 months for an amount not to exceed $95,000 for the term of the agreement, and authorize the Health Services Director to sign.
And I second that.
I have a motion and a second. All in favor?
Aye.
Any opposed?
No.
Motion carries 4-1. Director Arden, Lisa Farraco, thank you very much.